Hark Books and Harper Audio present Floored, A Woman's Guide to Pelvic Floor Health at Every Age and Stage by Sara Reardon. This is the author. A note before we begin. Don't forget to download the accompanying enhancement PDF from your audiobook provider. It contains useful information, images, and more. To all my people and their pelvic floors. Introduction: the current state of down there care. If you fall, I'll be there. Floor. It starts when we are young, when we get our periods. When we first see blood, we feel scared. When the adults around us talk about it in hushed tones, we grow ashamed, as if discussions about our bodies should be hidden. As we get older, we slip tampons up our shirt sleeves when walking into bathrooms and roll used panty liners into toilet paper to hide them in trash cans. If we have a baby or menopause looms, we start wearing black pants instead of colorful ones in case we leak a little urine. We avoid intimacy with our partners because of pain, or perhaps worse, we silently endure sexual discomfort for fear of letting our partners down. When it comes to down there, hushed conversations have become too much of the norm. Women suffer in silence because our pelvic floors are not the priority in our healthcare system. In fact, we might not even know what a pelvic floor is. And when a pelvic floor issue arises, we're presented with three options. 1. Treat your symptoms by spending money on an array of medications and elaborate devices. 2. Have surgery or procedures to, quote, rejuvenate your vagina. 3. Deal with it. If you are a woman, the culture of silence around matters relating to your vagina began when you were a teen or even younger. And since then, pelvic health problems are either dismissed or you're presented with an extreme fix. My patient Beth is just one example of many. When she first came to see me, her eyes were full of worry. 45 years old, a mom of 2, and a surgical nurse at a hospital, she spent her days lifting patients in and out of bed and her evenings hoisting strollers, groceries, and kids into her SUV. Her children were growing like weeds. Some of her patients were 2 times her size, and she felt like she could handle all of it until one evening. She was in the shower after a long day, rinsing her lower body, when she felt a lump at the opening of her vagina. She panicked, as one does when they feel a lump anywhere near down there. Concerned about cancer or an abnormal growth, she immediately made an appointment with her gynecologist. After a visual inspection lasting not even a minute, her doctor had an answer. It's nothing unusual, her doctor proclaimed. Your bladder is falling out of your vagina. It's called prolapse and happens to a lot of women. Just don't lift anything too heavy. That's it. Just don't lift anything too heavy. As relieved as one would be to hear it's not cancer, a bladder falling out of your body still isn't good news. Beth's care that day was grossly insufficient, but it's also all too common. She is just one of many women who have left their doctor's appointment feeling dismissed, frustrated, and scared. Over the past 2 decades in my pelvic floor physical therapy practice, I've treated thousands of women like Beth, who before seeing me were denied open conversations and real tools to manage their pelvic floor problems. In every direction, we hear narratives that undermine the intimate issues that women experience. Commercials advertising incontinence liners send the message to consumers that leaking is just part of being a lady, when physical therapy can actually improve or prevent this. Trusted medical professionals view pelvic organ prolapse as a normal part of motherhood, so countless women make do with unrelenting pelvic pain. Medications for overactive bladder promise a better quality of life, but don't mind the laundry list of side effects. Scented vaginal washes declare a fresher, cleaner vagina when vaginas aren't dirty and only water is needed to rinse them. Nearly 1 in 3 women suffers from a pelvic floor disorder, from painful sex to prolapse, back pain to constipation, and urinary leakage to lack of orgasms. Although pelvic floor issues are common, they are not normal. But most of us aren't taught what the pelvic floor actually is, let alone how to care for it. So if problems begin to develop,
Sample complete. Ready to continue?